Everyone, good morning. I'm Dr. Haliza. I'm the consultant obstetric and gynecologist in Andorra Women and Children Hospital. Okay, so today I would like to talk to you about menopause and a new product in town that I am very excited to share with you guys. Yeah, so briefly, I'll just talk to you about menopause. Many of my patients are worried about being menopause. Are they going to shrivel like a prune, or are their quality of life going to be really affected after they get menopause? So here I'm just to highlight some of the things that what to expect when you become menopause, and now there are measures that we can take that is not uh, hormone replacement to help with the menopause symptoms. Yeah, so menopause, the average woman in Malaysia and in the world is about 51 years old. Okay, so it is diagnosed once the patient, the woman, has no menses for 1 year. But there are also a transition period for many menopause women from the age of 42 to about 48, right, or 50, that they will have this thing called transition period to menopause, which usually starts with irregular menses, and they may also have to have other menopausal symptoms, which I'm going to talk to you about later. All right. So why do women have menopause? And is a natural process for us women. All right, so when we were born, we had millions of ovaries, eggs in our ovaries, right? Eggs in our ovary. But as the time goes by, due to ovulation, and some of those eggs did not ovulate, so it will just die. All right, so that is the natural process for us women. All right, so, but menopause does not mean our life has to stop. In fact, it is the beginning to many, many exciting new roads, right, for many women. So, but there are certain women, as actually it is reported, so about 85% of women may have symptoms of menopause. It's just whether they report it or not, all right? So, what are the most common symptoms of menopause? One is Vasomotor symptoms, which is hot flushes, even though everybody else is cold or is in the aircon room. The patient will feel like very hot. Their skin can become red, and they really have excessive sweating. All right. Secondly, vaginal dryness, which is very common. Painful intercourse because of the vaginal dryness, low in libido, mood swings, okay, and also insomnia. And to a degree, some patients will have urogenital problems such as urinary tract infections, prolapses, and also urinary frequency and hesitancy. All right. So about 20% of women will have some form of mild, moderate, or severe symptoms of menopause, right? And amongst the most common is vasomotor. So the vasomotor symptoms in some patients can last up to 1 to 6 years after the menopause. All right. So as we know, once you have this